Hi, my name is Marlene Torres. I'm a Psych MP nurse practitioner student at Bradman University. Today I'm doing a integrative therapy video of 3 psychodynamic modalities on a patient I have been seeing for over 3 months. The patient is a 40-year-old married Hispanic male with a history of anxiety and depression. He fears his wife is going to divorce him due to them not getting along for the past several months. He has been more irritable, aggressive, and argumentative since losing his job over 2 months ago. He feels worthless and like he is failing his family and marriage. His medical history is in 2016, he had a left wrist fracture. There's no known allergies. There's no history of alcohol or substance abuse. There's no history of inpatient psychiatric treatment. He's not on any medications. His family history is his mother has type 2 diabetes and his father is deceased over 10 years ago. He has been married for 4 years with 4 children, and he has a bachelor's degree. On exam, he's alert-oriented ×4. He's cooperative. His speech and language is normal. He's goal-directed. There's normal content. His judgment is intact. His remote and recent and recall memory is intact. His language is abstract, and his foundation of knowledge is excellent. In his culture, the man is head of household and he has to provide for his family. Divorce is looked down upon, and he's supposed to work things out no matter what it takes. I will be using 3 different modalities that will help the patient think about. I'll be using 3 different modalities that will help the patient change his way of thinking and help him engage in ways to better view himself and his relationship. I'm going to be using cognitive behavioral therapy, CBT, interpersonal therapy, IPT, and gestalt therapy, which is considered role play. CBT is talk therapy that teaches new ways of changing negative thoughts to positive thoughts. The patients have negative behaviors and emotions that lead to automatic assumptions and core beliefs. The key words are automatic thoughts, which are presumptions that occur in response to a situation. Meaning that if he was to take in a test, he didn't get a good grade, he will say, "I am a failure." Underlying assumptions are negative thoughts that is a result of something. So if him and his wife get a divorce, he will say, "If I get a divorce, then I'm a failure to my family and my friends." A core belief is belief that people have about themselves that influence their thoughts and experiences in situations. The second modality is interpersonal therapy, and it was founded by Hoda Patlow. This therapy is good for patients with depression, anxiety, social phobias, postpartum depression, dysthymia, bipolar disorder, PTSD, eating disorders, and anxiety. It addresses relationship issues with family, friends, co-workers, and anyone who have problems with others. It helps to enhance or make communication skills, both verbal and non-verbal, better. The key words for this therapy is what or who is your trigger in life. Gestalt therapy is a role play therapy by Fritz Perl. Gestalt means make hollow people into real people. The purpose of this therapy is to help people discover themselves, manage to develop solid self in the here and now. It's also a talk therapy in which the patient will be talking to an empty chair to pretend that he or she is talking to the person that they've had the problem with to let them know their true feelings. These modalities can work for any culture or background because it has the person look inside him or herself to find a better version of themselves. My overall expectation upon completion of this therapy is to have the patient feel better about himself and communicate more effectively with family to create a stronger bond with his family. I will be doing section 1 currently now. Now we're going to do section 1, in which I will have my patient here. Tony, do you understand and give consent for these sessions to be videoed and audio taped and submitted to Grambling University?
Yes, I do.
Thank you. Hi, Tony. How are you today? So in our previous sessions, we spoke of you arguing with your wife and kids. You stated that you are having negative thoughts such as you feeling worthless. I gave you some homework to help you change those negative thoughts to good thoughts. Did you write down those thoughts when you noticed your mood change or when you had negative thoughts about yourself?
Yes, I was able to.
That's good. Did you change all the bad thoughts that were listed into good qualities about yourself? And did you read the positive thoughts back to yourself? Were any of those negative thoughts true after doing that?
Yes, I read the positive things back to myself. And, well, I realized nothing I had written down that was negative was true.
Okay. Yes, that is right. Even though you're thinking something bad about yourself doesn't mean that it's true. Did you like your homework assignment? Did you think it has helped you since the last session when I saw you?
Yes, I do believe it did help. It helped me think more positive about myself and how I am still contributing to my family. Whenever I do start to feel anxious or negative about myself, I do the homework assignment.
That's good to hear. I'm glad that it's working and helping you. Well, the next session we'll try a new therapy that will also help you improve your communication skills with your wife and kids. It's called interpersonal psychotherapy, IPT. Would that be okay with you?
Yes.
Okay. Well, until I see you again next week, we will then do section 2. Hi, Tony. So now we're, how are you doing today? I'm sorry.
I'm okay.
That's good. So today we're going to do interpersonal psychotherapy, which is called IPT. We will work on bettering your communication skills verbally. And then there are things that can stop you from having an accurate presumption of a situation, such as stereotyping or generalizing the situation. You can also not be truly invested in the conversation. You can have distorted focus. You can also be assuming similar interpretations, meaning that, if one thing happens, then you think that same thing's supposed to happen with every situation. You can be missing integrated cues. Can you go ahead and give me an example of one of those 5 different strategies that we were just discussing?
Yeah, sure. I guess maybe like my wife will say one thing, but I interpret it like she's saying something else.
Yes, that is correct. Okay. So, there are some things that can affect communications that will actually help you to better your communication with people. So the better communication strategies are analyzing your own perceptions, working on improving your own perception, or focusing on others. Have you ever heard of any of those?
Yes, I have.
Okay, well, can you please give me an example?
Uh, I guess maybe like an example of analyzing my own perception, or at least what I'm seeing, and looking at it the way other people might be observing the situation.
Okay. All right. Well, thank you. Those are really good examples, Tony. Thank you for sharing with me. All right, we'll work on some of these in interpretations more in the future sessions, so we can have so you can see other viewpoints and we can give other examples. Okay. Um, I would like for you to use these strategies when you have a conflict with your wife or your kids. Do you think that you can do that?
Absolutely.
Okay, thank you. So then next time when we meet, um, we will work on we'll work. So sorry, next time when we meet, if you have an argument with your wife or your kids, can you will be able to use some of these strategies to go ahead and hopefully make the situation better.
Yes, I will.
And then I would like for you to tell me if it made it better or worse for you to look at their viewpoints, or interact with them a little. Will they help you to interact with them a little differently?
Yes.
Okay. All right. Well, during our next session, we'll also use your responses. So if and when you go home before you meet me next week or the following week, if you get into any arguments, I would like for you to use these strategies. And then when we come in with our next session, we're going to do some role playing. And we're going to use a therapy called gestalt therapy, sorry, in which you're going to be talking to an empty chair, but you're going to pretend it's the person that you are having the problem with. So you're able to explain your feelings to that person. Is that okay with you?
Yes, it is.
Okay. All right. So we will then see each other in a week or two. So I hope you have a good week, Tony. All right. Session 3 with Tony. Hi, Tony. How are you today?
I'm fine.
That's good. So, were you able to use any effective communication strategies?
Yeah, somewhat. I don't know what I did wrong. I mean, she was angry at me, saying that I don't listen to her.
So you guys had an argument. Okay. So, do you mind if we go ahead and role play? I guess this therapy will be perfect. So you're able to express to your wife how you truly felt about the situation after thinking clearly and after thinking clearly after the argument and seeing where you could have gone wrong or what you could have done better. So can you please talk to your wife? She's sitting right there in the chair.
Look, listen, there's always yelling, screaming, saying that I don't listen to you or you don't listen to me. But look, here's the thing. When those arguments start to happen, it's not that I'm purposely blocking you out or just not listening to you. I mean, you have to remember there's so much going on in my head. You know the things that I got going on, and sometimes I feel like that doesn't matter to you. But I mean, I get stressed out, I get anxious, I get overly worried about, the bills, me not having a job. It's a really hard thing, and I mean, sometimes I feel like you're just not on my side, and I would hope that you would understand that I'm going through this, and you know, you would help me out and understand that, instead of just flat out saying that I don't listen to you. You know, I mean, I hear you, but I mean, maybe if you can just say it again or remind me. I mean, I got a lot going on.
Okay, well, that's good, Tony. Is that all what you needed to say to her?
Yeah, pretty much.
Okay. Well, that will go ahead and conclude our session for this week. I would like to see you in a week or two, if that's okay with you.
Yeah, sure.
All right. Well, I hope you have a good evening, and until we meet in a week or two.
Okay.
Okay. You have a good one. Okay, so my summary of this patient is that the patient that we did three different therapies that helped him view himself better, which decreased his anxiety and depression. It may take several sessions to get him in a state that he will automatically use his coping strategies, CBT, and interpersonal therapies. And it actually can take up to 20 sessions before the patient will have an optimal outcome. But with every session, the patient will hopefully get better. My goal for this patient, after he completes all of his 20 sessions, is at the end of all of his psychotherapy sessions, he will be able to communicate effectively with decreased aggression, anxiety, and depression. And his depression symptoms, will be decreased. And he'll have positive automatic thoughts about himself and have a better relationship with his family and friends. And he will also be able to effectively communicate with his family and friends by not only looking at his viewpoints but also their viewpoints. Well, I hope that you've enjoyed my presentation today. Thank you.